I am back, and this video will be very, very important for all of us, I think. I got the results of my test, the test that I did last Thursday. It took a little while, and now we'll explain you why, but I'd like to tell you different things about this thing. First of all, the test is not easy to do, so I would like to tell you that just like the doctors are actually trained with Dr. Zamboni, they will tell you that it does need a three-day training to teach people how to do the ultrasound the right way. I was very concerned about having the test done because I wasn't sure if I was going to get somebody that was going to pay attention to the details and was going to follow the steps of the test that you can find actually on the internet. Now, I found the sweetest and kindest woman ever. She is a technician that did my test last week, and she took an hour and 20 minutes of her time to follow every single step of the directions that I gave her, that I brought with me. And she was able to do, I think, a pretty good job because something was found. Now, before I let you know everything, I want to again underline the fact, because I think it's really important, not to go to do the test to your normal doctor. Of course, you have to ask your cardiologist to have this done the way I did, and I had other reasons why I went to a cardiologist, because in fact, I'm doing a test right now as we speak, and I've had many heart problems. I have to be more specific, so I'll explain you. I had very strong chest pain and burning. I don't have them anymore, so I have to remember. Chest pain, burning, and I felt spasms in the chest area. So I decided to go and be checked by a cardiologist. The cardiologist listened to me when I talked to him about CCSVI, and he agreed to let me do an ultrasound. He wasn't accepted right away of the Dr. Zamboni study, but he was willing to listen, and he did listen. Then I did the test a few days later, and the ultrasound technician was, like I said, a very wonderful woman, because she took the time to listen too, and she brought the papers that I brought with me home. She studied them, and then she gave me the test, which again usually lasts about 30 to 45 minutes. Because she wasn't trained at doing the test, she took a lot longer. She took an hour and 20 minutes because she was looking for the right things that most, again, technicians are not used to look for. Well, the doctor called me today. First of all, I really would say that he's a very kind person, and I kind of call him the Dr. Greenberg of cardiology, because he reminds me of Dr. Greenberg, my old neurologist. He's willing to listen, and he was very kind. So he called me at home today, and I went back to the hospital to do 2 tests, but he called me at home, and I got his message, talked to him, and he explained to me what's going on with my veins. He did say that the right side of my neck and the veins are okay. Everything looked fine. On the left side, the jugular vein, he said that also looks fine. And then all the way in the back of my neck, there is, he sees that there is a drainage problem. There is a vein that is not draining the same way as the others are. And he did admit something that most doctors will not tell you. He said that he's not used to looking at this at all, that he's used to look at arteries and veins in a different way, and that this is the first time ever that he sees something like that. So he admitted this, which I think is very nice, because again, a lot of doctors don't do this. And also he explained that he's very willing to listen and to learn more about CCSVI. And when I explained to him that I might go up to Buffalo and redo the test or be accepted into the clinical trial, I asked him if he would be willing to learn more about it, if he would be willing to look at the results of the test. And he said yes. and you will be willing to let others doctor know about this. So I'm extremely thankful. I've been so lucky. Again, I don't have medical terms to explain to you what he found. I don't have a piece of paper that I can read to you. This was a phone call, but he was very kind enough to explain to me that, again, the right side of my neck is fine, the left side, the jugular vein is okay, but there is a drainage problem in the back, all the way in the back, which, again, a normal technician doing a normal ultrasound will not be looking for. So again, if you go to have this test done, try to go to the places that have, the people that have been trained. So definitely in Buffalo, from February on, and I was told by Dr. Zivarnvo, you will be able to go and do the test, the right test, because they will accept self-referrals. So try to go to places where they have the right technicians that were trained to do the proper test. If it is not possible for you, then make sure that you really have the right doctor, because you need to find one that definitely will listen to you, will be open to listen, and will be open to learn. This man was just, he's willing to learn about CCSVI. I think this was a good opportunity to ask for the CCSVI test, and I found the right people, so I'm extremely grateful. So thank you so much for listening. Keep up with talking about this, talking about Dr. Zamboni. Please ask your doctors and push for it too. And if you have a way to go up to Buffalo or to Canada, to the right places, to do the right test, please go. Okay? Thank you so much, and have a good day.